Thank you, Madam Chair, and thank you, Administrator Verma, for being here today to testify in front of our committee. Last year, Congress removed Medicare reimbursement restrictions in 5 areas, including telestroke services. Do you think telehealth would be useful and effective in other critical care scenarios, especially for rural hospitals like I have in my district that may not have specialists in these small communities?
Absolutely, and I think that's one of the things that we're trying to focus on in the Medicare program, and part of the reason why I have some concerns when you hear about proposals to put everybody into the Medicare program. Unfortunately, the Medicare program often is very slow to respond to new technology. That being said, our administration has focused on telehealth services. We've expanded the number of telehealth services that are available in rural communities. And we've also provided remote communication technology to the entire program so our beneficiaries can easily access care.
Okay, I want to dig into this a little more. The federal government is among the most prolific users of telehealth and virtual care technologies, including the VA, DOD, IHS, NASA. Unfortunately, just 0.25% of Medicare fee-for-service beneficiaries used telehealth in 2016. Meanwhile, the government has funds, grants projects through HRSA, SAMHSA, FCC, and others. We know that some grants may be duplicative across HHS operating divisions, and it's often difficult for healthcare providers and patients to understand how they can better access telehealth services. With limited resources available for telehealth adoption, it's important that we spend all of these funds wisely. Can you help us understand how these different entities across the federal government coordinate policy development, federal funding opportunities, and best practices as it relates to telehealth?
Sure. One of the things that we have going on at Health and Human Services is the Secretary's convened a Rural Health Committee. So he's sort of bringing together all of the agencies under HHS to focus specifically on rural health. And as part of those discussions, we're talking about how we can expand telehealth services to make sure not only people in rural communities, but even urban communities can access those services.
Okay. And do you believe there's opportunities to exist to improve coordinations and efficiencies further?
Absolutely.
Okay. Are you aware of any national telehealth strategy? And if not, should one exist?
I think there's been some focused effort on this in rural communities to make sure that, a lot of the problem is even if telehealth services are available, they may not have broadband access. And so the administration has focused on that as well. Telehealth is a great example of innovative technology that can really go a long way to improve access and to improve healthcare and outcomes. And so would love to continue to work with you on that issue.
Well, it's a real area of attention for us, given I represent the state of Montana. We have a lot of space and not many practitioners. We don't have specialists. Telehealth is one way to bring those to these rural communities so they can maintain the viability of our critical access hospitals and others. So I appreciate all that CMS has done to increase access to telehealth services. The federal government has a commitment to keep to our seniors and ensure they have access to high quality, affordable health care. Congress should focus on leveraging both federal funds and lessons learned so that those who need access most have it, particularly folks in rural areas. We should prioritize efforts to expand telehealth access and fully realize the potential it has to provide services to all our seniors with access to reliable, quality health care. I have a minute left. Is there anything else you'd like to tell the American people that hasn't been addressed today?
I would like to focus on some of our efforts around rural health because I think it's an important area. We've been concerned about the 100 hospitals that have closed, rural hospitals. We're also concerned that 40% of rural hospitals are operating at a negative margin. This is why we've taken action with the wage index to increase reimbursement to hospitals in rural areas. And we're also working on something, a new model for rural communities to basically think about how they can redesign their system. I think those decisions need to be made at the local level, can't be made in Washington, but it's an opportunity for them to rethink the structure and to move in more value-based care. So we're excited to continue our work and our commitment to rural communities across America.
Again, I want to thank you for your work at CMS, and thank you for being here today. And with that, I yield back.
Thank you.
Gentleman yields back.